is a presentation about creating an inclusive environment for LGBT patients. And just to note, the acronym, it encompasses all people who are not cisgendered or heterosexual. So the acronym goes on. There's many people who are encompassed in it, but we're just going to abbreviate it for now, just so you know that. And we can introduce ourselves first.
I'm Maya. I'm a second-year medical student at Geisel.
I'm Anna. I'm also a second-year medical student at Geisel.
Kira, second-year medical student.
Lucy, first year.
We're all part of the Rural Health Scholarship.
Yeah.
So you know that. Okay. And we also wanted to acknowledge that, like, not everyone here is a part of that community, but we thought it is important that everyone starts and continues and has this conversation so that the burden is not, like, just on LGBT people to work on creating inclusive environments.
So I helped work to develop this training with a clinic in Montana. So just acknowledging the work we did together. There were many different providers and members of the community and doctors, nurses, PAs who all came together to develop this training. And this is a very condensed version of the training. It was like a 3-hour session, and this is just the kind of meat of it.
Before we go to the next slide, we're going to do an activity called I Am the One. So you each got a slip right that has a little story on it. And I'll start, and we'll just go around this way, and everyone can read really loudly so we can all hear the statement. So I'll start. I am the teen living with gay parents. I'm afraid to ask questions about sexual health because I don't want my doctor to think my parents can't answer my questions as well as straight parents can. Oh, sorry, yeah.
I am the domestic violence survivor who found the support system grow suddenly cold and distant when they found out my abusive partner is also a woman.
I'm the father who has never hugged his son because I grew up afraid to show affection to other men.
I'm the one who came out to a doctor who had a safe space sign in the store, always felt supported by him, now want to be a doctor myself.
I'm the girl who got kicked out of her home because I confided in my mother that I'm a lesbian.
I am the man who has a uterus and a vagina. I don't think my doctor knows this about me.
I am the young queer man of color whose doctor assumed I came in to get tested for HIV when really I wanted a referral to physical therapy.
I am the one who doesn't see my gender identity represented in registration forms.
I'm one of the lucky ones, I guess. I survived the attack that left me in a coma for 3 weeks. In another year, I will probably be able to walk again.
I'm the one who stopped going to the doctor after having to correct their staff for using the wrong pronouns 2 visits in a row.
All right, and while we kind of sit with some of those feelings, we'll kind of work through a little bit more information. First, I'm going to kind of give you some stats about this particular community. The first slide is about transgender individuals, which would include adults and youth, and then the next slide is going to be more specific to youth and some information that we have about those individuals. So we know that, and naturally there's a lot of facts and stats we could have pulled. We pulled some for a variety and to just give you guys some numbers to think about. 65% of transgender people reported discrimination in one or more public accommodation settings in the past 12 months. 19% of hate violence survivors are transgender. 1 in 6 transgender people report having been incarcerated in their lifetime. Because of fear of discrimination, 1 in 5 transgender people postponed or did not try to get health care in the past year. 29% of transgender people reported having to teach their healthcare provider about transgender health issues. And some specific facts about youth, because we know a lot of people do work with young people, and this is a really important demographic to us as well. So in a recent risk behavior survey of LGBT youth, 10% were threatened or injured with a weapon on school property. About a third were bullied on school property. 28% were bullied electronically. 18% of students had experienced physical violence during dating, and 18% of students have been forced to have sexual intercourse at some point in their lives. And we're talking about a survey taken of high school students here.
Okay, and so now we're just going to go through some language and have words that in this training they suggested to avoid saying and some suggestions to use instead. But we also wanted to recognize that language is always evolving and also different patients prefer different language. So that the most important thing is to ask people what language they prefer, or if you're corrected, to really take that and use whatever language you get asked to use and to not be offended, and that, yeah, it's okay to make mistakes as long as you're then respectful and use the language that people prefer. And also, like, this stuff, yeah, might change, but yeah, so maybe I'll put up the word and then people could like yell out a word that they might use instead. So the first one is hermaphrodite.
If you have thought, you can just popcorn out and we'll show an example that we have and why. Anyone?
It's okay if the word you're thinking of might not be, if you want to say compare, think out loud, it's okay. This is supposed to be an environment where, we share and learn from each other.
So ambiguous genitalia.
Yeah.
Our medical term.
Yeah, so it could be that, or intersex, and mainly the idea here is that hermaphrodite is a stigmatizing and inaccurate word with a negative medical history attached to it in the past. And then I'll put this up because, yeah, it's kind of confusing. So a lot of people, not everyone, but a lot of people prefer the term gay to just being homosexual because it's often has in the past connoted medical diagnosis or people being uncomfortable. And then born female, born male, things like that. What do people think we might say instead? Yeah, or assigned female or male at birth. And I think this language is preferred because that more accurately depicts what happens at birth. So a baby comes out and often it's assigned a gender right away based on the genitals that people see. But that doesn't necessarily reflect the person's gender. Yeah. This one might be confusing, but I think this is something that we see across medicine too, that we don't just want to call people like, oh, that's a gay, because those are adjectives that describe people, just like we wouldn't call someone who had a substance use disorder just like, oh, that's an addict, like it's a person with a substance use disorder. Not that those are the same, but just using person-centered language.
Can I ask a question?
Yes, please.
Could you define how you're using gender? Is that the preferred sexual orientation of an individual? So it's their ownership of their own sexuality?
Yes, so gender identity and sexual orientation are two separate things. So the gender identity is more, what do I feel like I am? So that is different from the sex that might be assigned, or the gender that might be assigned at birth, because people might be born with XY or XX chromosomes or have certain genitals, but that's more of when we're talking about like biological things, we talk about sex, and then when we're talking about how people identify themselves, we talk about gender. So even if I had XX chromosomes and female genitals, if I identified as male gender, then that is what we're talking about here. So it could be assigned female at birth, but identify male. And then sexual orientation is a totally separate thing. So that's more of like, who am I? Who is a person attracted to, or who do they want to be in a relationship, or anything like that, about like who do they want to be with.
So it would be like gender orientation is me, how do I feel, and then sexual or gender identity, and then sexual orientation would be who do I want to be with. And you can have all different combinations of that. So you can be like cis and straight, or cis and gay and trans, and like attracted to different people. So they're not necessarily tied together. I don't know if anyone else wants to jump in with any other
And I think one
explanations.
thing to note is like if I present as a female, but I say that I identify as a male, for example, then that would be me asking to be called with masculine pronouns or whatever pronoun I specify. So maybe it would be they, or so that's an important thing to make sure you ask how your patient would like to be identified, regardless of how they present in that case. And that's a gender identity.
Yeah, it's interesting you didn't want to confuse us with LGBT plus
Yeah.
at the beginning. And I remember about a year ago, I was confused about what the plus was all about, so I Googled it. And there were 20 different permutations that relate to both gender and sexual orientation.
Yeah.
It's just
There's so many options in both category, and then combining, you can pick from this category and pick from this category, so there's many combinations of how you can express your sexuality and your gender. And
But I'm gonna try to go back to your question, because I think I heard you ask how you guys are using the term gender. And at least what I'm hearing, I think, is gender refers to how you orient yourself.
That was my,
Yeah.
that's what I was trying to understand.
Yeah, I think
Okay.
that's
Which-
all that
Okay.
explanation you
You
gave.
misunderstood. I thought it was like gender versus
Yeah,
sexual
yeah.
orientation.
Yeah, so
And-
it's irrespective of biology.
yes.
The way you're using the term gender is about how do I identify.
And so when you're interacting with someone, the gender, how they view themselves, is the gold standard, right? It doesn't matter what the sexual assignment is. In fact, it sounds like biology at this point is sort of irrelevant. It's really how the person sees themselves, how they choose to engage socially.
And that's when we would prefer using the word gender, whereas you might use the word sex to describe the genitalia that somebody has, or
The biology.
right, the biology of their body might, the word to describe that might be using a word like genitals and describing what the genitals look like, or the word sex to mean the XY or XX chromosome combination that that individual has, whereas gender is specific to how they see themselves as maleness or femaleness or neither.
So, and maybe this gets ahead of things, but when a person is asked, for example, on a form or something, about sex, used to be either male or female, does the person answer that according to their sense of gender, or do they answer that according to some biological criteria?
And are there more than two choices now?
Yeah. We'll get to that more, but it can be a very difficult thing to navigate for. If your choice doesn't appear on the form, then that can create some issues.
Okay.
And so I think also different people might answer that question differently by what they feel comfortable with at the time. But yes, and there are more than two options. Like I know that New York State recently created an option to have like no gender on the birth certificate. Like people could go back and not have it say male or female. So I think things are changing with respect to that, and that often these things in the past have been sort of like set in stone based on what you were assigned at birth, but that is changing now.
So when you talk about non-binary, that's what you're talking about.
Mm-hmm. Yeah, like if I don't identify as a male or as a female, in the past you're forced to select one or the other, but there are some places where that's not. People aren't being forced to do that anymore.
Thank you.
And yeah,
We'll
And I
touch
think-
on this more, and some of our examples get at like the nuances of kind of these issues. Yes. So we would not say transgender people and normal people. What would we say instead?
People.
Humans.
No. So cisgender. So if you use the word normal to refer to one group, you're implying that the other group is abnormal or there's something wrong with them. So we have transgender people and cisgender people. And yes, cisgender means that you identify with the gender or the sex that you were assigned at birth. So if you came out and people assigned you female and you identify with that your whole life, then you are cisgender.
But I did hear a lot of people saying that, using words like people and everyone and individuals, that's part of what we're getting at too, is that, people are people rather than specific gender identities that, they may or may not subscribe to.
So can I ask another question?
Yes, of course.
So, Peter and I and others do a lot of teaching to medical students or some college students and things like that. And especially in the medical profession, we do a lot of case-based teaching, so we're talking about people. And almost always, in the opening line of those cases is male or female. Yeah. And I'm just wondering, is that offensive to some people to use those terms in that context? Does it feel like we're being insensitive in assigning?
We'll get to this later in an example, but if you had a patient who was assigned male at birth and identified as a female, you would refer to them as a male to female presents, because it is important to recognize
transgender.
Yeah, or transgender woman. So you identify them with pronouns that reflect their gender identity that they are asking for at that point, not their organs they have. But it is important to note, like if you have a cervix that needs to be checked out, or you need a pap smear, and even though you identify as a male, so it's important to note that, but to refer to the patient with the pronoun that they ask. But yeah, I think just saying like woman or man in a clinical vignette that you're giving to medical students, I have not heard people be offended by that, but I think that when people are going out of their way to use the most inclusive language, they would always say like cis or trans, so it'd be a cisgender woman or a transgender woman, and they're both women, but they might have different medical needs based on whether they are cis or trans. So yeah, there are definitely some people who I read that use that qualifier no matter who they're talking about, so that you're not only using it when someone's transgender also, because then that creates like a difference.
Yeah, I wasn't thinking so much in the context of transgender, things like that, just, a biological woman who assigns herself a gender of female. It's okay for me to call her a female.
Yeah. I think
you don't need other modifiers.
But if you wanted to, you could say a cisgender female, and that might spark a conversation where a student's like, why did you write cisgender? And that could be an opportunity to say, well, it's a born female who identifies as a female, so. Okay,
that's a new term for me.
Yeah.
I think it's interesting too. I think it brings up where people talk about different groups with inclusive language, where in a case vignette would it always be relevant to say an African American male, a white woman. So, I think we have these discussions often too, where, does the race information need to be in the vignette? Is it helpful and useful? Does it help? Does it bias the way we're thinking about the question? And I think you're bringing up a point too, where, gender could be part of that discussion too. Does it matter if we say woman, man, cisgender woman, transgender man, as ways of categorizing people? But then, in a teaching setting, sometimes it, does help students to classify diagnoses they're learning about based on maybe some markers they've been given about certain groups of people. But I think it's a really important discussion to have, and we do have it at our school about race, whether or not it's useful to identify somebody's race or ethnic background in a vignette. So I think you bring up a good point that's worth exploring with people who write educational material for students.
So we would not say like both genders or opposite sexes, and instead talking about all genders.
and this is getting back to the point that we kind of talked about before, that there are some people that might not identify either as male or female, and we're not trying to imply that there are only two genders. And so yeah, there can be like people all along a spectrum of gender identity. This one, just like using non-gendered language again, like everyone or folks. This is, men, mailman, fireman, policeman. That's maybe more basic, but just taking the word man out of identifying all of these things, because there are other ways to have that language, and people of all genders do all these jobs. Yes, and so when pronouns are unknown, it is preferred to use, or people can also choose this pronoun for themselves, but yeah, we would never use the word it when referring to people, because that is for objects, and people often might ask to use the pronoun they, and that's something that I think is hard for some people to get used to, like using the word they when referring to one person, but that it can be like really important to some people in making them feel like accepted, or like you're using the pronouns that they prefer is really powerful to make people feel respected.
I listened to As It Happens, the Canadian broadcasting show, and a few nights ago they had something on just that topic. In French, you have to have masculine or feminine, and it's really a problem for transgender people, because they don't have you can't use a they, essentially, so they're trying to come up with another word that you can use, and I think they're using something like IL, EIL, or something like that. They're really struggling with it right now in French.
Yeah.
I think we really struggle with it. There have been groups trying to come up with another pronoun, because if you're an English major like me, it's really offensive to use a plural or a singular. It just goes absolutely against all your training. And I have a family member who's trans, and from the time biologically he was female, there was this long session when she was they, and we just had a terrible time using it. All of us just kept stepping over it, because it's really tough to use what feels like actually just bad English.
Yeah.
Irrespective of the issue underlying.
Yeah.
And we end up saying, okay, this is the preference. Use they, but boy, it's tough.
Yeah.
So I thought there was a movement to come up with a different word.
I've heard like Z or
Z, that's what it was.
Yeah, that's what I've heard is like a word that didn't previously mean anything that's been assigned to. And some people, when we ask what pronouns do you prefer, also mean, he, she, they. It could be like, what pronoun do you actually prefer? What do you want said to you? And let them choose what that word is, even if it's one you haven't heard before. You write it down, and that's the one you use to the best of your ability. Because
to the best of your ability.
Yeah, but I think and the things that you're saying about English, have come up a lot, and I have read things written by trans people saying that when people make the effort to use that pronoun, you're kind of showing that you care more about this person and more about making them comfortable than you care about rules of the English language. It's
So,
yes, definitely.
so sometimes when we're writing and we want to be deliberately ambiguous about sex, you'll put S/he. Is that acceptable, or is that? I mean, that's sort of binary. So
It's still binary.
Yeah, I think that's not preferred by some people. So,
of course, usually when you're using that, you're not referring to anyone in particular. You're just using it in a very generic way to try and be inclusive.
Right.
Oh, yeah. Like you're referring to not a specific
No,
person.
no.
Oh, okay.
Or he or she might
Yeah,
be.
yeah. I think that's, yeah.
We do talk in
it's still
Yeah, it still kind of implies that there are only two, but.
Yeah.
We will talk about it in a bit, because we know that it's important to clinicians to know how should I be documenting. And some of it too is, what if my partner is reading this medical document and I want to communicate to them some, a male to female transition, and then, using the patient's preferred pronouns, but it's important for clinicians to be able to communicate accurately to each other information about the patient, and that does come up, and it's important to people that their documentation be accurate as well.
I will look into that and get back to you.
Okay.
Yeah, I think it's binary, so don't. So they would be.
See, I actually use that a lot when I'm just writing generically.
Because in English it feels better because you're not using a plural to
Yeah.
describe.
Right. Your grammar checker will let you.
Yeah. I don't know if anyone else has any input, but I think, that's still like the gender binary, and that they might be a better choice. But- Okay, so when asking people, like even kids, about your mom and dad, or asking people about their boyfriend or girlfriend, that instead to ask about parents or asking about partners. So if you ask a kid about their mom and dad, and if they have two parents who are women or two parents who are men, and then you're forcing them to always correct you or to feel like maybe their answer is wrong or doesn't belong. So you can ask about parents. And I know even on forms, I worked in an OB clinic in Ontario before coming to med school here, and we had parent 1 and parent 2 on the form, and just things like that to make people feel welcome, and that.
And I think the boyfriend girlfriend thing is really, it's an everyday thing. I know I catch myself when I meet someone and they say, oh, I'm going to see you, or if you say, oh, do you have a boyfriend, or if you're talking to a woman, you can kind of assume, but to try to just, in your everyday life, just switch that language to partner.
I especially see that in clinic when I'm shadowing. When people are taking their sexual history or social history, I see that a lot.
Yeah, and that's a good point about even in everyday life.
I've kind of changed away from that just because boy, girl feels demeaning, never mind how the gender's dealing with it.
Yeah, definitely.
But even we have a person in our class who talks about this being a problem a lot because she just got engaged to her partner, and people are always asking is he a medical student too? And she's always no, yes, she is, but people just make that assumption all the time in life, and it might not seem like a big deal in this single moment, but when that's your lived experience and you're being forced to constantly correct everyone around you, it's 5 seconds in their life, but for you it's your whole life spent correcting people.
So these are just some kind of best practices that are, if you're interested, you can take with you, but these are some things we came up with for the training in Montana. So only asking questions that are necessary to your interaction. So if you have a trans patient, not to say oh wait, so how does sex work for you, or something that is not necessary to your clinical interaction. And to make sure the questions are standardized for all patients, and we have an example about this, but it can be that can be hard if you have a 75-year-old male from rural New Hampshire who's why are you asking me about my pronoun, but we'll talk more about that in an example, but that can be an opportunity for education. But if it's standardized for all patients, it'll become normal. It won't be this awkward thing to have to navigate. And asking for preferred name and gender, and using that preferred name in your notes with other providers. And then just listening to how people refer to themselves. This is especially important when talking about reproductive organs. If, just asking a patient what words feel comfortable to them to use, and then using those words.
I think one example that's easy to highlight for people is that somebody who may have breast tissue might prefer to call that part of their body either their breasts or their chest. Just asking what what words do you use to describe your body, and then using those words that they choose to use.
For example, if it's a female to male, assigned female at birth, identifies as male but hasn't undergone any reconstructive surgery, they might refer to the chest. And then, so we just thought if you had any ideas of things you've done or know of that you could do, examples could be having a write-in gender on your intake form rather than a binary, or having an option for male, female, other. Any ideas people have, or something you could see at your own practice?
I had a question about that male, female, other. Because I could see other being
Other, yeah.
not
Or sometimes
really
just like
inclusive.
a write-in, a fill in the blank, or
Yeah, I guess I was wondering if just the idea of other is being offensive to people.
yeah, that's a
Because
good
you're
one.
not-
I think we would have to consult with someone from
Yeah.
the transgender community about that, but I think that's a really good point.
Other feels kind of alien.
Yeah, that's like
Yeah.
putting someone in.
But it might serve at least as a,
Right.
you're right.
It opens up the
Yeah.
at least
At least
option.
it opens the
Yeah,
conversation
I think it's certainly
instead of
better
the
than-
assumptions that happen
Yeah.
right through the door.
Yeah, agree.
So at least it would alert you to say, oh, here's somebody who I need to talk to about what's your preference
Yeah.
right away.
And I think another thing that could be important is making sure that you're training everyone, the front desk staff. So the moment a patient walks in, that there's some kind of, they don't get immediately a turn off of like, oh, you checked female, but I don't think you look, like the little microaggressions that can kind of make somebody really skeptical of receiving medical.
I think also there's a lot of I don't know that people always ask. I think people make assumptions and assign
Right.
a gender or a race in that registration process sometimes too. That's tricky.
Yeah, like maybe you haven't filled out a form, but you are late and you
Yeah.
walk into the appointment and you just write, okay, female, whatever. Yeah.
Any other?
Yeah, that's any other. So another thing that's really important is that it's okay to make mistakes. This is not how our language, culture has worked. It's different. It's new. If using they with a single, it's okay to make mistakes. It's okay to slip up, but just kind of encourage your patients to correct you. I mean, they know that people make mistakes, and
And then just be respectful, like when they do correct you.
Yeah.
And I think that's what seems to matter most to people.
and not to dwell on it or oh my gosh, I'm so sorry, and not make them feel like they have to then say, oh, it's okay, just kind of apologize, move on, and then try to think about it and use their name if you don't know their pronoun or if you can't remember.
And I think that was an important point also, to not dwell on it and make a huge deal where then people feel like they need to console you for having used the wrong language with them, because then it just puts more emotional work on them to try and make you feel better about having made a mistake.
Yeah.
We can just accept what they say and move on.
And a few things to just think about is that not everyone wants gender affirmation surgery. So if presentation assigned female identifies as male, maybe they don't want to change anything. They don't want hormonal therapy. They just want to identify as male, and that's just kind of making sure you don't bring in any judgment of your own into.
Can I add to that? Because our experience in this family situation also really changes over time.
Yeah.
And that's a really key issue. So over a course of a few years, there was really different. And you had to be really careful not to assume that what was happening at last 6 months ago vacation when we all got together was present. I think as a providers, we have to recognize that people who are transitioning are doing just that. They're transitioning. So they're often their sense of identity is in this fluid space, and it's gonna be different, so you have to go in with a fresh curiosity each time.
And to be open to asking.
Yeah.
I think it can be an awkward question
Yeah.
to say, but to just say, "Hi, I haven't seen you in a year. How would you
Bring
like?"
me up to date.
Yeah.
What's
to be identified,
or-
what kind of pronouns to, and just being okay with having that conversation is important. Also, insurance, that can be a big barrier, so understanding your patient's insurance and what it covers and what it doesn't cover. And the assumption that that mental illness is related to sexual or gender identity, so not if there is a problem with mental illness, not to just immediately assume that it's because they're transitioning or because they just came out or something
The
like that.
insurance, there's another part of the insurance business, and that's that a lot of transgender people have not legally changed their names. And they show up at an office like our office, and their name is they say, "Hi, I'm John," and say, "Well, your information says your name is Karen."
Yeah.
Yes, and it's very, very awkward. And there is no in our office is not really good privacy. The office I get my care in is not good privacy to really deal with that issue right there, and it's very awkward for
And
thousands of people.
I guess we took this out, but another thing to think about is if you're sending a prescription to a pharmacy, ask the patient what name they would like you to use, because you might, by using the name they share with you, that you might be outing them if they haven't come out publicly, for example, or if the name doesn't match their insurance, maybe they'll ask you. So making sure you ask that question before you send a prescription to a pharmacy. And being open to discussing banking eggs or sperm, just bringing it up if that's something your patient is interested in, if they're undergoing transitional surgery. And then, just thinking, so this example of the pharmacy and not unintentionally outing a patient, maybe a pediatric patient, to their parents if they haven't done that yet, or it can be like sending a name somewhere that they haven't asked you to. So.
And then we have some examples or scenarios we want to discuss. So the first one is that we have a patient who is a 26-year-old woman who recently began hormonal therapy to transition male to female. She asks you if you have a gender-neutral bathroom in your small rural clinic. You tell her that you do not. What do you do next? How would someone approach the situation? What would you say or do?
So I would say use the bathroom you're comfortable using. I mean, in a small rural clinic, who cares? And then I think most of us might change. Most of us might change the signs to say, male, female. I mean, today there are just shared bathrooms everywhere, and it's sort of like, get over it. But I understand somebody's still got those kind of signs up, and we might really think about changing.
Yeah. So we talked about, we discussed this, and something that what we would say is apologize that you haven't changed the signage and addressed that and made it an inclusive bathroom situation for this individual, and offer to walk them to the bathroom and that they could use the one that they identify with.
If they wanted you to. You're not like, oh, I need to escort you.
You can offer.
If they're uncomfortable.
And that way, if there is somebody who is like, "What are you doing?" Somebody else in the bathroom, you can just kind of just.
That's nice. So our second case, because we do know that a lot of providers tend to have questions about specific certain medical exams that might be important. Prostate exams on individuals who have a prostate, or a pap smear on an individual who has a cervix. So we thought of this case. So a transgender man comes to you for a wellness visit. You realize that he hasn't had a pap smear in 10 years. As the provider, what do you say? And what do you write in your notes?
Well, you need a pap smear. You have a cervix. So I've been in this situation, and that's what you say. You have to get a pap smear done. And a lot of it depends on what kind of surgery they have had and how easy or not it is to access the cervix.
Or they might, they might not have had any surgery, but they might.
Might not, right,
Yes.
right.
So we, yes, was there someone else? Oh.
I think this is really important because this brings up the issue of gender dysphoria. So a lot of times with trans individuals, like genitalia can be a very personal thing, and also something that gives a lot of stress to an individual, especially when a medical provider is going to examine them. So I think it's really important to ask if they're comfortable with you even performing a pelvic exam or something, and talk about how they refer to their genitalia, what words they prefer, and why is it that this person hasn't had a pap smear in 10 years. Getting that conversation. They might have had a really negative experience in the past.
Yeah.
Feels like a shared decision-making moment.
Yeah. Yeah. And I think that idea of the gender dysphoria and the anxiety that some people can have is really important. I remember at one conference that we had at Geisel 2 years ago, we had a transgender man come and talk to us, and he had recently moved to Boston, and he said the most stressful part of his entire move was finding a gynecologist, because he knew he had a cervix and he knew that he needed care, but it was the scariest, most stressful part of his entire move, because he knew he would have to go into medical offices and maybe be experience microaggressions or aggressions or discrimination, and try to find someone who he could talk to and get this care that was he knew he needed, but was very anxiety provoking for him. So I think, just being aware that everyone, people have different experiences, and just being respectful of that. And
Thank you. I think you guys came up with all the really important points about, asking for, obviously the decision making in general, whether or not the exam is going to be performed, but recognizing some of the background understanding of some of the anxieties that might be present for that individual. But at the same time, providers have to weigh the importance of preventative care, or care in general for the organs and body parts that a person may have who identifies in a variety of ways. And then I think our note here is just about the annotation in the chart. So when talking about charting, because I think a lot of providers are interested in this too, that you want to indicate if transition has occurred, that the proper terminology would be female to male or male to female, so that you are reflecting that information accurately and also communicating that in the chart to other people. And then you would use their preferred pronouns also in your charting as well. So
this is really tricky.
Yeah.
And I've had this direct experience of putting on the problem list transgender, and then male to female or female to male. And I've had a patient say to me, I want you to take that off the problem list. And I said, why? And he said, it's not a problem. And I said, there are lots of things on the problem list that aren't problems, right? We put healthcare maintenance or wellness, adult wellness, or those kind of things. But if you show up in the emergency room with MVA and multi-trauma, and you're unconscious, and you're having an evaluation, your anatomy, it matters. People need to know this. And my other argument would be that this person, one of the reasons he was neglected for 10 years in getting appropriate care for his cervix was that doctors avoid this. They just don't want to deal, and it's sort of not out there, so we just skip it in our conversations, particularly long transgendered people. I've got a few of them who are in their 60s, and you really aren't even thinking. They're men, at least the small group I had. In my mind, they're really men, or they're really women, because they've been that way for 20 and 30 and even more years. So you forget. You don't even, your brain doesn't say, oh my gosh, you still have a cervix, we've got to do something about this. So the issue of documentation, I think, is really tough. In my particular situation, once I explained why I thought it belonged on the problem list, this person, he was fine. He said, oh, I get it, okay, you're right.
Yeah, it seems like it could go in it's important to have that in a prominent place on the chart, but
Exactly.
it seems like having to put it in the problem list, like if there was some way you could put it right with the patient's name, like a right in for the gender even, if that was an option,
Right.
you could do that. And I think the big thing that we're trying to avoid is if there's handoff between providers and the patient is always having to correct the provider and having to explain all over and over. But I think that brings up a good point, and I don't know a lot about how the EHR works or the charting, but I think like this is something that.
And given your example, I mean, I think you displayed a very, trust and communication is the core of, talking about these things. And, explaining to the patient why it's on that portion of the chart. No, I don't think it's a problem, but it's important to me that if you were to have an emergency, somebody would know this information about you. That does show I respect who you are as a person, and this is, part of my role to document this in a way that makes sense and keeps you safe, but that having that discussion rather than just being like, well, that's where it goes, and, or we're gonna keep it is.
Yeah, I think that's the most.
Sorry, yeah, in that case, how are we defining like transitioned female to male? Because this person has not had any medical surgical.
But you can transition socially.
Okay.
So I think that would be something to ask the patient.
In terms of documenting though, would that be like clinically documenting? Would that be?
I think that would be an important thing to know is if they've had, like in the past medical history, if they've had reconstructive surgery, or even just noting that female to male has had no hormonal therapy and no reconstructive surgery.